So ladies and gentlemen, as last presentation in the integrative oncology field, it's a pleasure for me to introduce the work we are doing here at the University of Zurich. And knowing that complementary and integrative medicine plays a role for cancer patients, also in Switzerland, is underlined by the systematic review which was done by Markus Horneber. And you can see that it is on average 40% of the cancer patients who use complementary and integrative medicine. It's around 50% in the United States. It's the lowest in countries like Finland and Italy here. And Switzerland is somewhere in the middle with 38% of the patients. And we know that this rate is really growing at the moment. So when we started in the beginning of 2014 to form as a new team here at the University Hospital, and it has passed the University Hospital. So Reinhard Saller, who had the chair before, also treated patients who had cancer. So we did not have to start really from nothing. But we were developing our therapeutic concept within the team, and we came to the point that for us, the values and the beliefs of our patients are important, our clinical expertise plays an important role, and the evidence which we have from clinical research. And when you see these three things, you might remember that these are the three pillars of evidence-based medicine as they have been defined by the founder, David Sackett. So in a way, this fits nicely into our mission that we really want to take those into account when we develop an individualized treatment for our patients, and we always try to execute this in a multi-professional team. We've mainly based in an outpatient clinic. I think we have a very unique situation because it's a kind of own department here at the university and the University Hospital, which includes also the chair at the university for complementary and integrative medicine. And I'm very happy to say that we have a strong oncological expertise with Matthias Rostock, who you see here in the photo, who is a well-trained oncologist, so has a very similar background as Mark Schleppi here, but he is also a naturopathic doctor, so he has decades of experience in treating patients with complementary and integrative medicine. Compared to Germany and the United States, we are small. Everything in Switzerland is a little bit smaller, I have to say. And we have 3 full-time equivalents of medical doctors in our team. We have 1 full-time equivalent of psychologist and 1 doctor's assistant. And these positions are spread over several people, so that in the picture you have more people than you see here as positions. When we developed our medical model, we were very sure that it is a kind of linking as integration model which we have here. What do I mean with linking? I mean that we have 2 separate or many separate entities, and we link our treatments with each other. So the oncologists, they are their own department, we are our own department, but they refer the patients, we are in the same hospital documentation system, we talk about our patients, but we can have also our own culture if we want. We mainly see outpatients, but we also get called to the wards, but usually we prefer to have the patients in an outpatient setting because it fits nicer into our treatment scheme. From the methods we use, we have decided that we use acupuncture, mind-body medicine, and phytomedicine as main treatment methods within our clinic. And our main focus is on cancer patients. You will see on the next page when I show you the numbers. But we also attract more and more chronic pain patients. And we have started a new project with the Department of Gastroenterology here at the University Hospital. So we have a special offer of patients with irritable bowel syndrome who also get mind-body medicine. And this is really a very joint and integrative program which we develop at the moment. So let me give you some numbers here. This is the 2014 numbers. We had 2,410 patient visits here. So compared to what Gary has shown us from Sloan Kettering, it's a tenth of what you see in New York. But you also see that acupuncture plays an important role here. And from the other patients, which were seen by the other physicians, it's nearly 80% of them have been cancer patients. And we get most of the referrals within the hospital. And this is also part of the strategy, that we really want to work closely with our colleagues from the other departments, but also specialists working in their own outpatient practices, especially oncologists also, but also primary care doctors refer patients to us. And we have started the development of mind-body medicine groups, and I will give insights about this a little bit later, 12 months ago. And within these 12 months, we had already finalized 6 cancer groups, and we have started new with the irritable bowel syndrome, and we have already run 2 groups on irritable bowel syndrome. From the coverage, it's the same as in St. Gallen. We have this unique situation here in Switzerland, which also Kodler, the medical director, mentioned here, that really these things can be covered by the basic health insurance. And everyone in Switzerland has to have a basic health insurance. And at the moment, we try that all of our services are fully covered for our patients. I'd like to give you an idea how we treat a cancer patient by really using a real case here, so that you get a feeling how we combine this treatment and on what our decisions are based here. So this is a young female patient. She got a breast cancer diagnosed beginning this year, and she had surgery, she had the chemotherapy, and during this clinical course, she really developed severe symptoms of psychological distress, and after the first chemotherapy, she was suffering from severe nausea, but also from severe fatigue. So she lost weight and she was really very fatigued. And she came to see us, and what we usually do when we do the mind-body medicine with our patients, and we do this in a group setting, but also we do it in a one-to-one setting, we love to use this Temple of Health. This is an adapted version from the one Gustav Dorbosch and Anna Paul have developed, and we really discuss with our patients their resources. So you see here all the aspects which are important for a human being. You see here mind-body medicine as a basis, mindfulness playing an important role in all of this. And then we have here several pillars like exercise, breathing, relaxation, nutrition, and self-care. And we discuss with our patients how strong they feel on each of these pillars and where they see resources, and if they really are interested to improve these resources to be more stable within the whole treatment setting. And you see here, she saw resources, but she was on none of the pillars really strong, and especially the relaxation side and also the nutrition side was something she felt really weak on. So when we developed a treatment scheme for her, we discussed the treatment aims, and for her, symptom reduction was very important. So she wanted to have, during the next cycles of chemotherapy, less nausea, less fatigue. She wanted to reduce her psychological distress, to have less anxiety, less depression. We also worked here closely with the Department of Psycho-Oncology together, and we made then in a shared decision-making with her treatment decisions. And so we decided together with her that she will receive acupuncture once a week, and we went always into the evidence. And as you can see here with the nausea, there's good evidence for nausea. You always see the Oxford grading of evidence-based medicine here and the grade level, but also if it is recommended in the German guideline for breast cancer patients, and the same is here for the fatigue. So we have one treatment which covers already 2 of her main symptoms. But we also were going back with her to the pillars, and we were talking a lot about exercise. And she had a history that she did a lot of yoga when she was younger and less busy. So we discovered this as one of her resources, and she was also keen to start this again. We helped her with a breathing technique, a very easy thing to really get a little bit more in a parasympathicus tonus instead of a sympathicus tonus. We introduced her to mindfulness meditation in a one-to-one setting. She received the audio on it, and she was very interested to participate in the mind-body medicine group. but this later after she has completed the chemotherapy because her schedule was already pretty busy during this time. And we taught her self-care acupressure on pericard 6, which she can apply before but also during chemotherapy. So you see, we developed with her a whole package which she found suitable. And when we go into the evidence, you nicely see that most of these things are well covered by evidence. Here the yoga, for example, has a very good evidence to increase quality of life, to reduce anxiety and depression in breast cancer patients. Same with mindfulness, meditation and mind body groups. Here we have quality of life, stress and depression, which are positively affected. And in addition, she got also an extensive counseling on nutrition to see what she can improve and also how she can integrate it into her life and also enjoy food more than she has done before. So this is one example how we comprehensively try to treat a patient. And as mentioned before, the mind-body medicine groups or the mind-body medicine overall plays a key important role for us. And the mind-body medicine groups we have developed in a very close cooperation with Gustav Dorbosch and Anna Paul. So in a way, Gustav brought it from the United States to Germany. We brought it from Germany to Switzerland, and we had to adapt it. We could not do 6 hours because this does not fit into any reimbursement scheme here, but we can do 3.5 hours. We started with 3 hours. But then afterwards, the patients came and said, 3 hours is not enough. We want to have more. So we negotiated with them and ended up with 3.5 hours at the moment. And the main aims here are really to restore the balance between mind and body and to strengthen the resources of our patients. So we have a lot of disease-specific cognitive information included into these groups. Coping with disease plays an important role. That's also the reason why those groups are really run by our psychologists in the team. Exercise, relaxation techniques, but when we talk about exercise, we include a lot of yoga and qigong movements there. And when we talk about relaxation, it's mindfulness-based techniques, but it's also guided imagery. It can also be autogenic training, whatever fits. It's a little bit that we give a lot of different tools to our patients, and many of the elements are very similar to those which you have been seen in the project in Essen. Nutrition plays a role. We don't have a kitchen so that we can't do the cooking, but we give recipes to our patients. They cook at home, they bring their food, they share it with each other. So it's always a very nice event which happens between the patients. And we introduce them to naturopathic self-care, but also to acupressure self-care. For example, we teach them acupressure points to reduce fatigue so that they have a number of self-care tools they can do on their own. And we always do a qualitative focus group at the end. And that's just one quote which I really like from one of our patients. She had a severe relapse. And she said, this group helped me to get through the cancer treatment. And this is the aim. When patients have this aim, we are very, very happy to support them, to have more strength to get better through the cancer treatment and also to cope better with the disease and what happens on the way. So that's why we will extend also in the future the mind-body medicine groups, and they will be always a very important part of our treatment model. But we are also trying to develop models which suit special situations here, and we have a very good cooperation with our Department of Radiation Oncology here, and we developed here a preventive project. So those patients who start a radiation therapy and want to strengthen their resources, and it's not only strengthen resources, it's also a little bit reducing the anxiety which comes with the idea that you have now 6 weeks of radiation treatment and what this is doing with your body and with your mind. And it's very much about relaxation, so mindfulness plays an important role, but also exercise, because we know that exercise reduces the occurrence of fatigue and that it is hard to implement it. And like in a health coaching style, we try to work with our patients that they find a way and the motivation to integrate this. If they need further treatment, they are very welcome to see us, so they can see us according to their symptoms and they get a very individualized treatment. But you have also seen that we are quite small. We see a lot of patients. We take a long time in a session with our patients, so the doctors usually have 60 to 90 minutes with a new patient, so that the patients don't have to come too often, and we get the big picture and also can introduce as many necessary treatments as possible within one session. But this also means we have a long waiting time now. At the moment, patients nearly have to wait 2 months to get an appointment. So in the future, we have to think about offers which are much easier accessible, and these are very often group offers, and these will be some of the new developments in the future. But we also try to combine research with our clinical development, and I only like shortly to introduce one of our current projects here, which is supported by the Institute of Integrative Health, which is a stakeholder project, and we are working on cancer-related fatigue, because we have discovered that this is an important thing in our patients. That's something which is important also for the oncologists, and no one really has a good solution for this. So what we have done in the beginning, we drafted a treatment model from the side of the complementary and integrative medicine experts, and then we involved stakeholders. So we have a stakeholder advisory board where we have our oncologists, the nurses, the psycho-oncologists. With integrated, we have a patient, we have patient advocates there. But we also had, with a broader group, face-to-face qualitative interviews. We did focus groups, and when I say we did, it's one of my team members, Claudia, who is a well-trained qualitative researcher who is doing this work. And at the moment, we are in the stage that we have analyzed all this data and discussed it in the stakeholder advisory board, and now we go into a much broader audience. We will do a survey much broader with the oncologists, the nurses, and the other stakeholders, and hopefully then develop in the advisory board the final treatment model which can be implemented. And I'm really keen to see if this final treatment model differs from the model which we have drafted on the expert level. So if the stakeholders bring in new ideas or other ideas than we had at the beginning. And this is a stage we are in at the moment. That is an expert-developed model. We have also published this in Tumor and Diagnostic, German Cancer Journal here. And these are, in the way, all the interventions where we have at least one RCT to back them up. And you see here also the conventional treatment, so the conventional drugs which you can use, also the psychological interventions in. But what you immediately see that complementary medicine in this evidence plays an important role. It makes a strong contribution here to have all this mindfulness techniques, yoga, autogenic training here, but also the exercise side, and acupuncture and acupressure play also a role. And now the big question is how we prioritize here, what comes first, do we include other treatments, which evidence do we accept here for the final model. Another thing I would like to introduce to you is a project which is supported by the German Krebshilfe, the German Cancer Aid. It's a huge network project, and Matthias Rostock and myself, we participate in this project from our affiliations which we have still in Germany. And you see here all the groups involved, and the first thing we have done is a needs assessment with patients and professionals, what is needed in integrative oncology. But we also developed a CAM consultation service, so patients and their relatives could get consultations on CAM information. A huge knowledge database was developed, and a website has been developed. And you see it was a very interdisciplinary group. We had oncologists, pharmacists, but also primary care doctors, specialists from complementary medicine, communication science, and epidemiology integrated. So this project, the first part is just finalized. We are just applying for the next 3 years here. But very soon you will be able to use some of the resources which have been developed there. But I have to say that's only for those who are able to speak German. So I'm sorry for our colleagues in the US. But the website, for example, for patients will be available, but also some of the data for the medical doctors. And I think that's the interesting part for the medical doctors here. And I'm grateful to my colleague Christoph Ritter, who is the PI on this project. He is a pharmacist at the University Greifswald. And they developed within this project a great interaction matrix. And this interaction matrix brings together a lot of the information which we have about the different herbs, and that's only some of them here, and really directly links us to the different medications which we use in chemotherapy. And when you see here red color, it makes very clear that you have to continue reading by all means before giving this to your patient, because there is some strong evidence that there might be interactions. If it is yellow, you should still continue reading because there are interactions possible. And if it is green, you can relax, no further reading, as long as there is no interaction expected here. And we still have some open areas which bring up research questions for the future. So we hope that perhaps in the next year, this is also available. And it makes it much easier if you know with the medication of your patient that you have to be restrictive or less restrictive with giving herbal medicine to them. So coming to an end, what is important for us is really that we connect patient care and research very closely. And I mainly showed at the moment the patient care side because that's what the symposium is about today. But we usually want to develop our research questions from our patient care, and we want to implement the results which we generate in our research directly into the patient care. And this is only possible because it's a really great team which I have here and who helped me to build this up and to get this started. And we are really looking forward to the future that this can grow and flourish, that we can provide more treatments for our patients. Thank you very much.